Assalamu alaikum and hi everyone. This is Dr. Maaz Qureshi, and as this is the second part of the ECG series, so we are going to be talking about the QRS complex. We are going to be talking about the ST segment, and in the end, we are gonna have some bonus items, but before that we are going to be talking about the T-wave. So stick around till the end to have the bonus or MCQs discussed. So let's talk about the QRS complex first. Well, the QRS complex, as you all know, the ECG, and I hope you are familiarized with the ECG. This is your PQRS T. Now, this is your QRS complex, which basically represents your ventricular depolarization. I'm just going to write DEP or contraction. As you all know, four-chamber heart story, that we have four chambers. So we are going to be talking more and more about the lower half or the ventricles. This one is your right side and left side. So QRS complex is basically the repolarization of the ventricle or the contraction of the ventricles. However, you should know this, that your nerve signals or your impulses travel faster. Impulses are faster than your actual mechanics or your ventricular contraction. So I can say that nerves here, just gonna draw a scary nerve here, funny and a scary nerve with a long axon, stuff like that, with a nuclei, and it's gonna travel faster. It's gonna have electricity faster than the actual heart itself. I'm just gonna use another it's actual mechanics of the beating heart. That is because it needs the mechanics need its energy from the calcium channels, and of course there are some conditions where you have low QRS complexes, and it is basically one of your pathology when you have a patient who has a previous history of MI. You can look for these QRS complexes, and these QRS complexes are normally, if they are this much thick, they would be quite of a low voltage. So let's suppose they would be just like this here after an MI. So all MI will show low voltage QRS complexes. Now, here's another fact which you should know, is that this QRS complexes, they tend to hide your, as they show the ventricular depolarization, so they hide your atrial repolarization. I'm just gonna write rep. So are there any conditions, are there any pathologies or conditions where we can see the QRS complexes not doing their job or not hiding the atrial repolarization? So this is one of the favorite question of CPSP, which makes your FCPS or holds your FCPS exams. And yes, of course, you have this condition called third degree heart block, where you can actually see your atrial repolarization on the ECG. Okay, so now let us talk about our next segment, which is ST segment. Now we talked about the QRS complex, and QRS complex basically is ventricular depolarization. It's a start of ventricular depolarization or contraction of your ventricles. But there is an MCQ where you will be asked, and this MCQ says that where does ventricular depolarization completes or full depolarization of your ventricles takes place? They can use a lot of different tricks to uh, to trick you, and you should not worry about if you have this concept. So notice the complete, I'm repeating this word, complete depolarization, I'm just going to write DEP, would take place in your ST segment, because this is the segment before your, this is the segment before your T wave, which is basically your repolarization of ventricles, and your QRS complex, which is your ventricular depolarization. So this here is your ST segment showing complete depolarization. I'm just gonna write CD, C dep. Okay, C is deep, so ST segment. Now there are a lot of things you will be asked and examined on your exams, and ST segment is the most important one in the ECG because it shows a lot of that where when there is an MI or when there is an ischemia, you should know that this ST segment is basically an ISO, means sane and electric, and it's normal, and basically you can also be asked about the ions which are responsible for this segment. So always choose calcium here, and they may ask you whether it is efflux, meaning a cell out of the cell, or influx, which is inside the cell. So always choose this one here, or the influx of the calcium. So ST segment is because of the influx of the calcium ions. Now remember this, that whenever you see something like this one here before the T wave, there is this one is basically your ST elevation or ST segment elevation. And I hope you have heard this term STAMI, which stands for ST elevation MI. There's another term which is non-STEMI, and there is the causes differ, and I'm not going to go into the detail. I'm going to make another video on that as well. But for now, let's suppose you see this ST elevation or ST elevation MI. So what can be the causes? So on top of your head, you should rule out infarction, and which can be seen mostly in pericarditis and presmental angina. However, if you check on the ECG leads, and there are different leads for different nerve supply, and if you see an L4 elevation, so the artery responsible would be left anterior descending artery. I'm going to make a video on that as well in the coming videos, so stay tuned. So STEMI will always show infarction. It can be because of pericarditis, mental angina, anything which causes ischemia to your myocardium. Now we have this T wave, which is quite important, being the last one. So we have covered almost everyone. This one is your T wave, and it shows your ventricular repolarization or relaxation, where the ventricles are ready for the blood coming from your atria. Here, the ventricular repolarization completes. Now, there are a few pathologies, but the most important one for the heart is your potassium. If you see high levels of potassium on ECG, you will see tall tinted T waves, and if you see less of the potassium in biochemical investigation, you will see inverted or U wave. You're gonna see U wave, and this shows you that you have hypokalemia, and then you can do required blood tests in order to differentiate different causes. Now in the end, for the bonus part, you have a QT interval. So QT interval, basically it represents the entire period of ventricular depolarization, and then your repolarization. So your ventricles just pump the blood, and now they are ready to get repolarized in your T wave. And you all know that this is basically QRS, which completes in what? In your ST segment. So QT includes both the depolarization phase of the ventricles and the repolarization phase. However, if you see prolongation of this QT interval, not segment, you will be likely to be suffering from a few of the important biochemical markers, being the most common, the glucose, the potassium, and the magnesium. So whenever you see QT interval, your brain should definitely tell you that there is something wrong with these three things, and these would be low or going down. So you will have hypoglycemia, you will have hypokalemia or hypomagnesemia. And what will happen if you see a QT interval with shortened or decreased QT interval? So you should definitely think about hypercalcemia here. You have increased calcium, or even when there is digitalis toxicity. So a few things to remember by. However, the hypercalcemia may also cause cardiac arrest systole. And as we discussed earlier, you have the U wave, which basically shows your hypokalemia. And basically, your U wave demonstrates or represents your depolarization of the most powerful muscle, the papillary muscle. Hope you guys learned something new. If you did, don't forget to subscribe if you haven't already, and if you did, thank you so much for all the support. If you use Facebook, do check out our Facebook page, MSQ Productions, where I upload videos like these. And if you like these videos, you can always stay tuned by clicking that bell icon after you click subscribe, which will tell you when I release a video. You will get notified. You can also become part of our Telegram group where we solve MCQs. Thank you guys for watching. Get it, got it, good.